Hello everyone. Today we're talking about myocardial infarction, abbreviated MI. So this is the overall look of the heart, and when you cut it open, it will look like this. MI happens in the coronary arteries, so here the red vessel in the pictures. So the first question is, what is myocardial infarction? The definition of the disease is lack of oxygen supply. And we actually have 5 types of myocardial infarction. The most common one is the type 1, which is plaque. Plaque block in arteries. So, and when the plaque happens in the ending part of the vessel, it might just cause minor effect. But when it happens in the bigger vessel, like here, it might end it up cause the dysfunction of the whole heart. Besides, we also care about the cause. First is diet. Because if we don't have plaque, then we might avoid myocardial infarction. And about our food, we should avoid food with high fat and cholesterol. Besides diet, we also have the following cause, and for the acute myocardial infarction, it must be the gene, like family history. About symptoms, we have following, but I want to make it easier. When you walk on the street, you see a person. He was grabbing his clothes and looked very uncomfortable, like the man here. He has high possibility that he had a MI. And MI is fatal. He might just death during seconds. So if you really happen to this situation, you should call 911 immediately.
Now, I'm going to talk about the complications of myocardial infarction. Myocardial infarction complications may occur immediately following a heart attack or may need time to develop. After an infarction, an obvious complication is a second infarction, which may occur in the domain of another atherosclerotic coronary artery or even in the same zone if there are any life cells left in the infarct. These are the complications of myocardial infarction. It will lead to the stroke, cardiogenic shock, congestive heart failure, cardiac tamponade, arrhythmias, pericarditis, and so on. So, what do doctors normally do to help the patient? The first one is the angioplasty. It's an immediate treatment, meaning emergency one. Is to unblock the arteries that supply blood to the heart. And so, the second one is the coronary artery bypass graft, also known as CABG. It's done immediately after a heart attack. It's performed several days after the incident, so your heart has time to heal. It's just to reroute your veins and arteries so the blood can flow around the blockage.
I'm going to talk about a number of different medications used to treat a heart attack. Other than all of the above, here are some drugs that we use to cure the disease. Try to imagine how myocardial infarction damage patient's health, and then you can tell what is the most important thing for the patient. First of all, we have to make sure there is enough oxygen supply for myocardium. Thus, there are drugs such as aspirin, nitroglycine, beta blockers, ACE inhibitors, ensuring the blood to flow by either widen the blood vessel or lower blood pressure. Secondly, if the blood clots flow to other body parts, it may cause infarction again, or sometimes even stroke. So, here comes thrombolytics, which can dissolve clots. Lastly, to prevent thrombus from forming again, we need clopidogrel to dissolve clots. And pain relievers are used to reduce any discomfort the patient may feel. This picture helps us to understand how the disease works and how we are going to cure it. We have to consider the risk of bleeding or other concerns are high or not. If the answer is yes, then we will consider using clopidogrel first, which is used to dissolve clots. If the answer is no, then we can use PCI by either using CABG or PCI, which we have already mentioned before. And here are also some drugs cured we use to deal with this disease. What should we do to prevent it? We can prevent it by changing our lifestyle, by doing aerobic exercise several times a week, and keep a healthy weight. And we should drink alcohol within the recommended limits and quit smoking. All this lifestyle may help us maintain a healthier body and decrease the possibility of having myocardial infarction. And if you are already a patient of myocardial infarction, the medication will be very important for you. And you should always be aware of your health because myocardial infarction may occur more often after the first attack. Thank you very much.